I'm Craig LeMoult. Tonight on Greater Boston, a GBH News exclusive, my interview with famed ethologist and conservationist Jane Goodall. We'll dig into her life's work, climate change, and her new documentary, Reasons for Hope. Then, as many primary care physicians age out of the field, a lack of young hires is making it harder to find an appointment. I'll talk with two doctors calling for more funding into the field so that everyone has equal access to care. Jane Goodall is known around the world for her long career studying and protecting animals and the environment. And despite all the setbacks she's seen over the years, she's still optimistic about the planet's future. She shares why in her new documentary, Reasons for Hope, which she screened at the Museum of Science earlier this week. While she was there, she joined me for an exclusive interview. Jane Goodall, thank you so much for joining us here in Greater Boston.
Thank you for inviting me.
This new documentary of yours that's screening here at the Museum of the Science, where we are right now, is really about hope and the people who are making a difference. And I wonder what that means to you.
Well, you know, I mean, I couldn't do what I do now if I didn't hope that what I was doing would make a difference. But I know perfectly well that to create the difference that I hope I can make, I have to work. It's, you know, I see humanity as at the mouth of a long, dark tunnel, and right at the end is a little star. That's hope. But we don't sit at the mouth of the tunnel and hope the star will come to us. No, we have to roll up our sleeves and climb over, crawl under, work our way around all the obstacles that lie between us and hope, such as climate change, loss of biodiversity, poverty, overconsumption, destroying the soil with industrial agriculture, etc., etc., etc. Good news, people are working to solve all these problems. Sadly, they're working in silos, and you can solve one problem, and if you're not thinking holistically, you're creating a problem somewhere else.
And the stories in the documentary really focus on some of the people who are making those changes, who are focusing on those problems and trying to make a difference. The hope, it seems at this point like it could be hard to hold on to that hope, that it could be drowned out by despair. You know, all the years that you've been working in conservation, despite all of your hard work, things have gotten pretty bleak. Do you ever feel that loss of hope, or do you still have faith that we can do what we need to do to turn the corner here?
Well, there are two things. I truly believe, and I'm not alone among scientists, that we have a window of time when, if we get together and take action, we can at least slow down climate change and loss of biodiversity. On the other hand, if any rational person looks around at the problems the world is facing today, you can't help but be depressed. So how do you then cope? You cope by saying, I can't save the world, but what can I do locally? What do I care about? Do I care about the plastic litter that's destroying life in the oceans? Do I care about industrial agriculture? Do I care, you know, whatever it is you care about? Okay, get together with some friends and take action. Do what you can do to solve what you are passionate about, and you will find you make a difference. And then when you make a difference, then you understand that all around the world there are people just like you making a difference. So then, for the first time, you dare to think globally.
In the documentary, you know, there's somebody gliding over the Alps to teach ibis how to migrate. It's amazing stories like that. Not the kind of thing that most of us can do in our day-to-day life. But as you say, hope is about action. What are some of those things? What are the actions that people watching right now you think can take, that you'd like to see them take, that really you think would make the biggest difference?
Well, you know that my passion is working with young people, because they are inheriting the mess that we've made, and so I want to help them as much as I possibly can. So our Roots and Shoots program is one of my reasons for hope, because when young people understand the problems and they're empowered to take action and to choose what actions they take, they are just so filled with passion and determination. And I go around the world and I meet all these young people now in nearly 70 countries who are taking action. And they are so dedicated and passionate, and they are making a difference. So, I mean, looking around at the world, looking around at all the problems, it is pretty grim. But on the other hand, there's proof that so much of this we can turn around if we take positive action. And even if just ordinary everyday people feel powerless, and they say, well, what can I do that will make a difference? If they just do one thing that they care about, like moving towards a plant-based diet is very important. And when you get millions and then hopefully billions of people making ethical choices in how they live, you see that you're moving towards a better world for the future.
You talk about the young people who are going to be most affected by this, and we have seen a lot of young people now becoming energized by this issue. A lot of the younger activists are taking sort of a more disruptive approach to raising awareness about this. Here in Boston this week, we have a number of actions taking place, disrupting traffic and things like that, to try to draw attention to these issues. And I was just wondering what you thought of that, if that approach.
Well, the approach does raise awareness, but at the same time, it's targeting people who will be extremely angry to be targeted like that, and it can backfire. Like, okay, you want to demonstrate against, the fact that companies aren't paying attention and they're continuing to burn fossil fuel. Well, go and demonstrate peacefully outside their offices or outside the government. Don't disrupt traffic so that ordinary people who may very well agree with you, but all they're doing is trying to get home to feed their children or to collect them from school. And so it will backfire, and those very people who could have supported you will now, I suppose hate is too strong a word, but they will be angry. And so for me, that's not the way, although I totally agree they have raised awareness.
Tell us more about what your approach has been. I mean, you've been doing this your entire career.
Okay, well, my approach is different with different people, of course, but say it's some person in government. My approach is find out just a little bit about the person you're going to speak to, with whom you disagree. My mother taught me right from the beginning, you must listen. So start off by listening to the person, because maybe they've got some, at least you'll get a better idea of why they think the way they think. And after this, then, because you've learned a little bit about them, try and find a story, because reaching the head with arguments ain't gonna work, because they will be only thinking about how can I refute this silly woman. But if you can find a story that reaches the heart, which is why you need to try and find a little bit about them. I mean, maybe you both love dogs, maybe you both have grandchildren, whatever it is, some little tiny thing. And then from all the stories I have whirling around in my mind, I can choose one. There's a story about a CEO that I met, and I'd been talking to a group of CEOs, and afterwards he said, Jane, for the last 8 years, I have been really, really trying to get my company more ethical in where we source our goods, along the supply chain, the way we interact in the offices around the world, and the way we treat our customers. 3 reasons. 1, I saw the writing on the wall that we are using up our finite natural resources in some places faster than nature can replenish them, if indeed nature ever can. Secondly, consumer pressure. People are beginning to say, well, if this product has harmed the environment, has harmed animals, is cheap because of unfair wages, I'm not going to buy it. But he said what tipped the balance for me was my little girl of 10. She came back from school one day and she said, "Daddy, they're telling me that what you're doing is hurting the planet." "That's not true, is it, Daddy? Because it's my planet." That reached the heart.
You know, you mentioned your mother. I was rewatching the 2017 documentary Jane about your work in Tanzania, and I was struck that when you first went there, your mother came with you. Can you speak about what her influence was on you and what it meant for your career?
Yep. Well, I think, you know, I usually start every lecture by talking about the fact that I was so lucky to be born with a supportive mother. I was born loving animals. She supported my love of animals. There's many stories of, you know, she didn't get angry when I took earthworms to bed with me. She just said, "Jane," I was 1.5, and she looked at me and she said, "You were looking so intently. I think maybe you were wondering, how do they walk without legs?" So instead of getting mad at me, as many mothers would, because obviously the bed was full of earth, she just said, "I think they might die, we better take them back to the garden." And that went on throughout my childhood, so many stories. And so when I was offered the chance of going to study chimpanzees, it was what was then Tanganyika, was a British-controlled African country. And the authorities said, "A young girl out in the forest on her own, that's unheard of, and we will not take responsibility." But my mentor, Dr. Louis Leakey, persisted. So in the end they said, "Okay, but she can't come alone." So who volunteered to come? That same amazing, supportive mother. She had money for 4 months. I had money for 6 months. And she really, you know, because for 4 months the chimpanzees ran away from me. They'd never seen anything like me before. And I knew that given time that I could get their trust. But I only had money for 6 months. And she was responsible for boosting my morale, saying, "Jane, you know, I know that you're depressed. I know that the chimps are being difficult, but you found a peak. From there, you're watching with your binoculars. You're learning about how they move around alone in small groups or many coming together when the food is ripe. You're learning the calls they make. You're learning how they make nests in the trees. You're learning a lot more than you think." So she really, really boosted my morale, and it was wonderful that she was there.
It's so great. It's so great that she was there with you. You know, you said that those years in Tanzania were among the happiest of your life, and as a child, that all you really wanted to do was spend time with animals, and that's what you really got to do there. I'm just thinking about your life sort of since then. It seems in a lot of ways to be the opposite of that.
It is, yeah.
Traveling around the world, speaking to huge crowds of people, doing press interviews like this one. You must miss that, being in that environment, or do you miss that?
Yes, they were the very, very best days of my life, particularly after I got my PhD and I went back and I could spend hours alone in the rainforest understanding this amazing ecosystem and feeling a very strong spiritual connection with the natural world. And it was only at a big conference, 26 years after I arrived in Gombe, that I realized that right across Africa, chimpanzee numbers were dropping, forests were being destroyed, and we had secretly filmed footage of our closest relatives that I knew so well in the wild in medical research laboratories in 5-foot by 5-foot cages. So I went to that 4-day conference, which I helped to set up, by the way. I was in Chicago as a scientist, planning to spend the rest of my life at Gombe. I left as an activist. I knew I had to do something to help. When people say, "Wasn't that a hard decision?" I didn't decide. I went as one thing, and I came out afterwards as something else. It was a decision that seemed to be made for me.
Where we are right now in the Museum of Science, we're in the tamarin room, and there's 2 tamarins right behind you. One is named Darwin, and the other is named Jane.
I'm so honored by that, and I'm so glad that they come to listen. They're so beautiful, aren't they?
They are.
Yeah.
Your research with chimpanzees was so groundbreaking in so many ways, including even changing the definition of what we think it means to be human, right? Before that, we thought it was making tools. But you were the first to document that chimpanzees, in fact, do fashion and use tools. And of course, you said you later got your PhD, but when you went there, you didn't have any real formal training, did you?
No.
And you've said that not having that training made you more open to new ideas. And I'm just wondering if you see any examples of that today. Are there places where maybe getting away from the old orthodoxies and being open to seeing things in a new way might really make a difference?
Well, I think it will make a difference. I mean, when I got to Cambridge University to do a PhD, even though I'd never done an undergraduate degree, Leakey said there was no time for that, but he wanted scientists to take me seriously. And I was actually told that humans were not part of the natural world, that humans were not part of the rest of the animal kingdom. That was being taught in 1961. Unbelievable that the chasm between humans and all the other animals was one that couldn't be crossed. And I don't know if it came from religious beliefs or what, but when I was told I couldn't talk about chimpanzees having personalities, minds, or emotions, that was wrong because they were unique to humans. But I had a teacher when I was a child who taught me that in this respect, these wise professors were totally wrong. That was my dog. You can't spend your time meaningfully with an animal like a dog, a cat, a rat, a rabbit, a horse, a bird, and not know. We're not the only thinking, understanding beings on the planet. And so Leakey picked me because I hadn't been to college. Then he told me I had to get a degree to be taken seriously. But today, there's this thing which we call citizen science. And it's young people going out, and older people too, and kind of mapping the movements of animals and plants and registering the occurrence of different plants and animals in different environments. And I think that if you have not been forced into thinking in a reductionist way, and you have an open mind, that there's still a lot of scope for young people to change the way we think.
Jane Goodall, it's an absolute honor to speak with you. Thank you so much for joining us today.
Well, thank you so much for inviting me.
You can see Jane Goodall, Reasons for Hope, for yourself. It's playing at the Museum of Science now. For tickets and more information, go to mos.org. Booking an appointment with a primary care physician has felt virtually impossible for a while now, and it could get even harder in the near future. As of 2020, a third of all PCPs in the state are age 60 and older, and less than a quarter of med school graduates are entering the field. That's led to the field shrinking in size, limiting the amount of care it can provide. So what's causing the problem? What can we do about it? And when will you finally be able to get an appointment? I'm joined by 2 primary care physicians in the state, Dr. Zoe Tseng, who is based in Newton, and Dr. Barbara Spivak, who's also the president of the Massachusetts Medical Society. Thank you both so much for joining us. Dr. Spivak, your organization reported a quarter of doctors in the state said in their survey said they plan to leave medicine in the next 2 years, but the issue's especially acute for primary care physicians, right? Why is that?
So I think primary care is one of the more difficult specialties for people. We are expected as primary care doctors to do multiple things. We want to promote wellness. We want very much to promote preventive care, like colonoscopies and mammograms, et cetera. We want to take care of people in their acute illness and then take care of them in chronic illness. And to do all four of those things well, you really need a team behind you. And the team is not just someone answering the phone at the front desk or having a good medical assistant to put someone in the room, but it's having potentially a nurse or a care manager or social worker to help you with, and behavioral health in particular. Those issues complicate what we do quite a bit. So to have that team really is important if a primary care doctor is going to deliver the kind of care that they want to deliver, that patients expect. But unfortunately, the payment system doesn't support generally having that kind of a robust team in your office. So the burnout rate is very, very high, and COVID really exacerbated that, particularly for the older physicians, many of whom felt they were at risk more than the younger physicians for getting sick with COVID. So I think what we've seen is that the older physicians are cutting back hours or retiring, not being replaced by the new younger physicians.
So a lot of it has to do with the staffing and getting the support to be able to afford that staff. Dr. Tseng, has that been your experience? Have you found that to be a challenge?
Yes, definitely. I think the issue of burnout is at different levels, whether it's from our practice assistants at the front desk to our medical assistants to our nurses, and then obviously as well the physicians. We all have an overwhelming amount of stuff we have to do every single day. On top of that, you know, the demands just sort of increase exponentially from exacerbated by certain things such as drug shortages, patients calling, sending us messages about, I can't find this prescription or that prescription, generic drugs that should be available and readily easy to get at the pharmacy, not available. So then we're scrambling, our front desk, our medical assistants, us scrambling to figure out what to do for that patient to access the medications they need. So it's been sort of one thing on top of another. I think COVID-19 also really exacerbated with the high number of messages and phone calls I received from patients, whether it was they're worried they got exposed, they got sick with COVID, now that they have to get vaccinated for COVID, now they have to get boosted for COVID, now they get tested for COVID. Now they have to, you know, just one thing after another that we had to learn on the go quickly to help our patients. And we were at the front of helping our patients. When specialists closed down, we were there in our PPE, seeing patients, really trying to protect our staff at the same time, but providing even care through virtual means, such as through telemedicine.
Well, is it easier now, though? I mean, you don't have quite the same difficulties, the challenges, the PPE that we had early on in the pandemic now. Do you hope that perhaps with the pandemic sort of waning, we'll say, that things get easier and maybe not as many doctors decide to leave?
Unfortunately, I think it's not. I mean, even this week, I can tell you the messages are only increasing. For example, there's starting to be a surge again of COVID-19. So I've got lots of messages from patients getting sick and seeking advice. Now there's COVID boosters out. Now there's an RSV vaccine for adults over 60 potentially to get. So inundated with phone calls and messages around these health things that are just popping up every day.
Dr. Spivak, what about pay rates? Does this primary care pay as well as other specialties?
So I've several things to comment on. I think one of the challenges for people coming out of medical school is that they have several hundred thousands or more of loans to pay for medical school, and some of them even have college loans that add on to that. And the salary and benefits for primary care doctors are typically lower than for some of our specialists. And so when someone coming out of school is looking at work-life balance also, you know, the primary care doctor is more likely to have longer hours and need to work 6-7 days a week to keep up with everything.
So what's the answer? What would make a difference in addressing this problem?
Well, I think there are several things. As primary care doctors, we have to shepherd patients through a very complicated system, and decreasing some of the administrative burden that is really administrative would really help. Some of the prior authorizations that we have to spend our time doing, we feel as primary care doctors, are a waste of time. Prior authorizations years ago was meant to be something for very high cost procedures or medicines that they wanted to monitor to control cost. Today, we have to prior auth generic drugs, asthma medicines and chronic lung disease medicines that are inhalants. Every year,
and that's the
change.
insurance companies are making these requirements.
So the insurance companies are adding some administrative burden that we could eliminate.
Are there other things that you would like to see that would make a difference and you think would encourage more people to join this?
I mean, I think, as Dr. Spivak was saying earlier, we really need a team-based care. So the physician being able to take care of patients who are really complex, but having adequate nursing, staffing, pharmacists to deal with all the prescription issues, including shortages, prior authorizations, enough mental health clinicians to help us when we're treating patients with depression and anxiety, which has skyrocketed with COVID-19.
Is that insurance companies paying more for these services? Is that a government change that could be made, or how does that happen?
I think both. I think insurances are increasingly, as well as Mass Health and Medicare, covering these services, but we need more of it. We serve as not only primary care physicians, but also specialists. I'm someone's cardiologist, rheumatologist, neurologist, because we also can't get them in to see specialists. So we end up managing all of that. And we really need the support to be able to do all that work, including the team that's behind us doing that work.
There's actually a bill in the State House now that is looking to pay primary care doctors differently. Right now, primary care doctors get paid by a fee for service. I see a patient, I get a fee. This bill changes that and would pay doctors for the panel of patients that they manage and would give them more money if they had more services, really to try to support and build the infrastructure and transform the culture of primary care.
There's a lot more that we could talk about. Unfortunately, we've run out of time. Thank you so much, both of you, for joining us today. Really appreciate you being here.
Thank you.
That's it for tonight, but come back tomorrow for Talking Politics. Adam Riley and his panel will dig into President Biden's prospects in the 2024 election. Plus, Beacon Hill has finally reached a deal on tax reform. What's in it, and what does it mean for taxpayers? They'll get into all of it tomorrow at 7. Thanks for watching. I'm Craig LeMoult. Good night.
Mystery.